All right, well, good afternoon. Welcome to today's update on COVID. Hope everyone is doing well. Hope you had a good Labor Day weekend. I'm going to come back to that in just a second. So just a very brief update today. So the good news is our trend line continues to go down. So if you look at our dashboard, you'll notice it says, I think 40, 41, but we really have 39 in-house right now between the two campuses, 17 in the ICU and just 3 on a ventilator. So making slow, steady progress as we continue to manage our way through this. We had a conversation with the city leadership yesterday with the mayor. We're seeing that similar trend across the city. So I think for the first time in many, many, many weeks, we're below 200 hospitalizations across the entire city. So again, trend lines are heading in the right direction for us. They're heading in the right direction for the city. Now, all that being said, as I think if you guys are following the news, you know that there's a lot of information out there. These large-scale events, you saw the thing in South Dakota, and you've seen schools starting to open. We're seeing these upticks. I checked actually on my daughter's school yesterday, University of Texas, and no cases, no cases, no cases. The kids are back in school, and all of a sudden you got 20, 30, 40. So we're seeing that across our enterprise as well. So the University of Florida opened up last week, so we're continuing to watch those numbers. We're seeing that in the city. We had Labor Day weekend, so we're kind of keeping our eye on things over for the next 10 to 14 days to see if there's another spike, which we hope that there isn't. But in reality, those are things that we have to watch out for. That actually leads into a good point around visitation. So you've noticed that we still have a no visitor policy, and part of the reason why we wanted to do that was, one, continue to get that number down, really reduce the risk for the patients, reduce the risk for our staff. We know that it's a huge burden on the staff and the patients when they can't see their family member, but it's a balance that we trade off right now. We're going to continue to watch that for probably another week. We'll probably get into middle of next week to make that decision, because we want to get past that point of Labor Day weekend, schools opening, to see if there's any spikes. I will tell you, I think of the other hospitals in the city, St. Vincent's has probably been the only one that's relaxed that policy. Everybody else is sort of following our lead, or we're following theirs, to make sure we can continue to keep those numbers going down the way we want them to. Also on the dashboard, as you know, we continue to monitor our lives saved, so well over 500 people. So congratulations and thanks to all the folks in all of our units who've been taking care of patients downtown and north, who've really done a good job. I know deaths is a big number and we should focus on it, but we should also focus on the folks that you guys are doing a great job of taking care of. PPE is in a good spot, and testing is probably the one thing that we're continuing to watch. And as the companies begin to roll out new tests, they're rolling out less of the old things, old kits. And so that's the give and take that we're trying to manage. We're okay for right now. We can still manage the patients that we have. We can still manage our outpatient needs. We can still manage our staff needs, but it is something probably of all the things on the dashboard that we're keeping our eye on. So other than that, it's been obviously a whirlwind tour. Football starts this weekend. Hopefully that's not another spike, as a reminder, because there will be fans in the stadium. So those are just other things that we're just gonna have to watch out for. And as a reminder, we should have the flu shot in and available fairly soon. So as soon as that becomes available, we'll let you guys know so that you can go get your flu shot. Because again, as we've talked about before, last thing we need is dueling pandemics. So other than that, hope everybody does well, continue to stay safe. And here's yet another message from a community leader to thank you for all the great work that you're doing.
Hi, I'm State Senator Audrey Gibson, and I just want to send a big thank you to all of the healthcare heroes at UF Health. I'm the daughter of a healthcare professional, and I know the hard work that you all do. So on behalf of the nearly 300,000 constituents in Senate District 6 and my family, thank you all so very, very much.